Many doctors and research call the rise in diabetes cases an epidemic of the world. Constant research is being performed to seek out new persons with diabetes treatments to control blood sugar and reduce the health-related side effects associated with the condition. Medications and alternative treatments are seeing the most progress. Pramlintide acetate, a new medication on the market for person with diabetes, is pramlintide acetate. This medication is administered at mealtime and is used to maintain healthy blood glucose levels by preventing the spikes that often occur after eating. The medication tends to be stronger than other blood sugar control options, which mean less medication and more effect. The use of pramlintide acetate is associated with nausea, so medication strength is increased very gently. Diabetes patients also reporting losing weight while taking the new diabetes treatment. Pramlintide acetate comes in a pre-filled pen injector. Ixinatide, another pre-filled injection medication. Ixinatide is one of the most interesting medications to hit the person with diabetes market. The source of the medication is the saliva of the Gila monster. Only type 2 person with diabetes are approved to use ixinatide. The medication is used to improve the body's natural ability to produce and excrete insulin. Decreased appetite may be associated with ixinatide, though the manufacturer is adamant that ixinatide is not a weight loss product. Saxagliptin, an oral medication recently approved by the FDA, is saxagliptin. This medication works to control blood glucose levels after meals. The medication is approved for type 2 person with diabetes only and can be combined with other person with diabetes medications or used as a standalone therapy. The combo diabetes medications. Several medication combinations have been created for patients who need to take more than one prescription to control their diabetes. The most common combination include metformin and another prescription diabetes treatment. Metformin is often suggested as the first medication to be prescribed to a newly diagnosed person with diabetes. Anti-inflammatory. Recent studies suggest that diabetes, an autoimmune disease, is caused by inflammation in the body. Much of that inflammation was thought to be linked to obesity, but not every patient with type 2 diabetes is overweight or obese. Other forms of inflammation in the body are now thought to be extenuating factors in the development of type 2 diabetes. Patients are turning to natural anti-inflammatories to reduce free radical damage to the cells which can cause inflammation. Under the skin blood glucose sensors, small sensors implanted under the skin can communicate current blood glucose levels with a small, handheld device. The device must be kept within a short distance of the implant, but the patient is no longer required to prick every hour or every meal to obtain current blood glucose levels. In some cases, the sensor can communicate with another new diabetes treatment device, the insulin pump. An insulin pump is either attached to the body with an inserted cannula or a skin patch that transmits insulin to the body. The insulin pump is battery-powered and programmable. Depending on the activity level, the pump constantly delivers insulin to the body. It acts, almost, like an artificial pancreas on the outside of the body. Some newer pump models can communicate with the blood glucose sensor. The insulin levels will not be adjusted, but the pump will beep if the blood glucose is measured outside of the programmed range of acceptance.